I'm Kristen, founder and CEO of b.well Connected Health, and I've been a healthcare industry executive for over 20 years, first with CMS and most recently with United Healthcare. And then my daughter got sick. And it took me 7 years and a near-fatal incident before finding her diagnosis, and I was an expert. So I left my position and launched b.well, named for my daughter Bailey, who I've called B her entire life, as a way to give consumers the empowered tools that they needed to become active participants in their own healthcare. As healthcare stakeholders raced towards digital, they each created a separate application or portal designed to service consumers. And what they did was created chaos. For consumers, they now have portals and passwords for every doctor, every hospital, every lab, every insurance carrier, all their employer-sponsored health and wellness programs, their HSAs, their FSAs, and what is now already more than 500,000 digital health applications that exist on the US cloud. And we wonder why we can't engage consumers in health. b.well solves that problem by creating 5 pillars of health in a centralized, personalized, and simplified experience for consumers. We first do the hard work and collect and aggregate clinical, financial, wearable, sensors, biometrics, social determinant, and other data associated with an individual. We then create personalized guidelines and actions and education specifically to an individual so it's relevant at the time that they need it. And then we connect them to point solutions. All of those 500,000 point solutions that exist out there, we surface to consumers at the time that they need them most for themselves or for their families. And then we connect them with their health tribe so they can share information and alert management with whomever they choose at whatever security level they choose to do so. And finally, we simplify who pays for it, what's covered, so that it makes it much easier for consumers to involve themselves in their healthcare experience. Regardless of the stakeholder you are in health, you have only a small fraction of the picture of a consumer. With b.well, you can stop chasing missing data and you can start targeting true health outcomes. And furthermore, your consumers can change over time. You can change those point solutions on the back end without ever having to re-engage the user because they're engaged once through the front end. We sell across the spectrum because multiple stakeholders can exist on the same platform, tailored to experience a personalized experience direct to consumers. And we created an administrative portal that allowed them to unleash that data that we collect and target populations specifically to an individual in a personalized way. In the last year, our pipeline, our customers, and our revenue have grown exponentially, including over 350% with 90% inbound lead generation. This is nothing more than a market signal that we are finally ready to embrace consumerism in healthcare and empower people like me to manage the care of their family a little bit better and a little bit smarter, and more importantly, for my family. Thank you.